Hello, everyone. This is James Templeton with the Templeton Wellness Foundation. It's great to be with you again today. And we've got a really special guest today. I think you're going to find very interesting. He's got a lot of good information on the subject of cancer and fenbendazole. And his name is Dr. William Makis, and he's here. He's going to be here shortly, and he's going to tell us all about himself, and we're going to have a very interesting conversation, I'm sure. And I just stay tuned for this. Don't want to miss this. But first of all, I'd like to tell you, if you don't know about my book, I used to have cancer, how I found my own way back to health. This is about my story, how I overcame stage 4 cancer and have survived for 38 years with stage 4 melanoma. And, it's one of those things where you got to kind of stay after things. You got to change your ways. And I explain all that in my book. And I think it will inspire you or your loved one or your friends. We all know someone that's going through cancer or has had cancer. And I think you'll really enjoy this book. Anyway, also, I'd like to tell you about our restaurant guide, Templeton List. Templeton List is the healthiest restaurants in America. This is something we do at the Foundation Templeton Wellness, of course. This is the best organic farm-to-table restaurants in the United States. And, it's just as easy as going on your cell phone, on your computer, whatever. It gives you works off Google Maps. It'll give you directions straight to the restaurants. And if you're in an area and like me and you travel and you want to eat healthier, it's important. So check out templetonlist.com. I think you'll really enjoy it. And, check out all of our interviews on Templeton Wellness. We've got some really good ones, some people that have great stories. Also, some of the foremost experts, I feel, probably anywhere, interviews with them, just like today, that can really help you and steer you in the right direction, because that's what it takes, just educating yourself and making the right decisions. You don't have to rush into anything in 1 or 2 days. Educate yourself a little bit, and maybe you'll make a better decision. So anyway, thanks again for watching. We're going to get on with our interview today. And we're here with Dr. William Makis. He's from Edmonton, Alberta. And it's not too awful far north of us. We're in North Idaho, so it's not too far up there. It's probably maybe more than a day's drive. I don't know, but not too far. But Dr. Makis, welcome today. It's a pleasure to meet you.
Thank you very much for having me.
Yes, and I'm very interested in your work and what you've done, and especially with fenbendazole and some of the other things that you're focusing on these days. And tell us a little bit about yourself. I know you're an oncologist, but tell us a little bit about yourself.
Certainly. I was born in Czechoslovakia, and my family fled communism in 1988.
Wow.
We escaped communism through a neighboring communist country and a United Nations refugee camp where we stayed for a year. We had no idea where we were going to end up. We were lucky to get approval from Canada. And so we came to Canada in 1989. My dad is a math professor at University of Toronto, where he worked for the rest of his career.
Mm-hmm.
And I grew up in Toronto. I then went to the best medical school in Canada, which was McGill University in Montreal. I obtained a 5-year specialization in nuclear medicine, radiology, and oncology. And so I've been in cancer for, I'd say, about 18 or 19 years now. I'm also a cancer researcher. I have over 100 peer-reviewed publications, all in cutting-edge cancer diagnostics and cancer treatments.
Wow.
When I moved to Alberta, I started a very large clinical trial using a specific type of targeted radiation to treat end-stage cancer patients who were completely given up on by their
Mm-hmm.
oncologists. We had a very large clinical trial, the largest in North America. We were curing about 85 to 90% of stage 4 cancer patients. And these were specifically neuroendocrine cancer patients, and some had brain cancer as well. But they had a particular receptor on their tumor cells that you could target. You could deliver radiation directly to the tumor cell. It wouldn't affect healthy tissues. And we were curing up to 90% of cancer patients.
That's great.
Unfortunately, then Justin Trudeau got elected. And
Oh,
within 3 months of Justin Trudeau getting elected, my cancer program was targeted, sabotaged. My medical license was sabotaged. They basically took it over, destroyed the cancer program in Alberta. And now Trudeau has invested over $300 million rebuilding it in Vancouver, British Columbia, where he controls it, where he has friends, in the provincial government. And they've basically monopolized those particular cancer treatments with medical isotopes. And so a lot of people will know that Justin Trudeau is heavily invested in COVID-19 mRNA vaccines. He's building an mRNA vaccine factory in Quebec. They're going to be building another one in British Columbia. But before COVID came, Justin Trudeau and his people were heavily investing into cancer
mm,
and cutting edge cancer treatments. They wanted to offer personalized cancer treatments. So it was called precision medicine, which would offer personalized cancer treatments. And so he invested hundreds of millions of public taxpayer money
oh,
into
wow.
monopolizing cancer treatments. And mine, unfortunately, was one of them. So I've been in a legal battle with the Alberta government for many years now. But what it has done is it has allowed me to explore alternative treatments, cancer treatments like ivermectin or fenbendazole. It has allowed me really to speak out about the dangers of, the COVID-19 vaccines and the side effects, the excess deaths, sudden and unexpected deaths. So it's given me a lot of freedom that other Canadian doctors simply don't have.
Yeah. Well, it's interesting. Here you are doing some really good work, helping a lot of people. And I hear about things like this all the time, and then they want to take you down and follow the money trail, sounds like.
Exactly. And it's funny because COVID is not the first time that, doctors have been targeted for their views or for trying to help patients with certain drugs, right? Like if during COVID you were trying to treat patients with ivermectin, for example, they came after your medical license, they tried
Yeah.
to, they fired you, they tried to strip you of your license, but they were doing this to doctors before COVID. It was often in the field of cancer where the pharmaceutical industry has very heavy control. And, if you're any type of oncologist, and I'm a nuclear medicine oncologist, so, I'm the type of oncologist who usually uses radiation to treat patients. If you don't offer the standard chemotherapy treatments that are approved by big pharma, they come after you very, very aggressively because there's big, big money in cancer treatments.
Yeah. I mean, just a regimen of chemotherapy can cost a lot of money these days. I know. I mean, I've had people tell me they spent up to $18,000 in U.S. funds, just from one chemotherapy treatment.
Absolutely.
I
And,
mean, it's crazy.
you could go through, 15 cycles of chemo. Sometimes you have to come back because you have recurrence, so they have to put you on a different type of chemotherapy. And it's not just the chemotherapy as well. Now there's what they call immunotherapies, and those can run into the hundreds of thousands of dollars for patients. And so, it's honestly, it's big business, big money, billions and billions of dollars in cancer.
Yeah. Well, I'll tell you, with kind of the way we lean here at Templeton Wellness, and just a lot of it's because of my background, I guess, but kind of more into the more natural treatments, things that seems to make sense as far as diet, detox, supplementation, and getting your emotional body in balance, things like that, but I stumbled across several years ago. Not that it was brand new, but it was new to me, and it was something called fenbendazole, which is none other than a canine dewormer, and like people would give to their animals, their small animals at home. And I discovered a man by the name of Joe Tippins, and we've interviewed Joe here 3 times, I believe, and we've interviewed several other people that have used fenbendazole only, pretty much only for their complete recovery, and I was just flabbergasted. I mean, how could this be? This is unbelievable. Is this a fluke? Is this just are they, what is this here? How would they how did this happen? But then, then you hear about the ivermectin and you hear about, the people that had COVID, everybody was giving people, I mean, the people that I knew that were doing very well took ivermectin or hydroxychloroquine or something like that, and all these are basically parasite formulas, right?
Yeah, so fenbendazole is really fascinating. It's an anti-parasitic, but when you look at the preclinical studies or the animal studies that have been done on it, there is extensive evidence of anti-cancer activity, and not just by one or two mechanisms, by a dozen mechanisms.
Mm,
And some of them are really, really unique and fascinating when you look into this. So, for example, it stimulates apoptosis and autophagy. These are different ways of killing
yeah,
cancer cells. But the way it works is a unique mechanism. It inhibits microtubules getting together when
yeah,
cells are replicating, right? So
mm-hmm,
when cells replicate, they require microtubules to put the nuclear material on, and so that cells can then separate once the nuclear material is duplicated. And fenbendazole interferes with microtubule formation. Now that works for parasites, right?
yeah,
But it also works for cancer as well, because in cancer you've got these rapidly replicating cells, and so fenbendazole interferes with cancer cell replication. And this has been proven. It's been proven in petri dishes, it's been proven in mice, but when it comes to humans, you find out that they haven't done the trials. And then you
mm-hmm,
think, well, wait a minute, why haven't they done the
yeah,
trials? Fenbendazole is very cheap.
yep,
That's, I suspect that's why they haven't done the human trials. And they haven't done it not because it doesn't work, not because it's toxic. It's actually very well tolerated. They
yes,
haven't done the trials because there's no money in it.
no money. Yeah, so it's like to take fenbendazole, 1 dose of fenbendazole, as far as the recommended dose from the Joe Tippins protocol is like $8, I think, something like that now for 3 packets for 3 days worth. And if
That's
you do
right.
it, if you do
So,
it every day, if
yeah.
you do it 6 days a week, for example, even, it's $16 a week. I mean, you can't even get a sandwich for $16 hardly anymore. So,
Exactly. It's literally it's dollars a day.
mhm,
When you think about this, and let's say, you're taking the fenbendazole for many months, right? And then,
yes,
you start seeing tumor shrinkage and so on. But, if it's dollars a day, the pharmaceutical companies are not going to make any money on it. And so
no,
there's a fascinating history there where even as an anti-parasitic, what the pharmaceutical companies did was they looked for a version of fenbendazole that is almost the same. It has maybe like just a very slight difference, but in the same family, same mechanisms of action. Then they took that, they give it FDA approval, and it's called mebendazole. And
mhm.
now that pill they're selling for several $100s a pill. Instead of, $1 or $2 a pill, now they're selling it for $300-$400 a pill.
And one of those pills, what would that be the equivalent to one of those little packets? Like, I'm talking about the 222 milligram packets of fenbendazole.
Right. So usually mebendazole comes in, I think, 100 milligram pills. But the point is that each pill would cost you $300-$400 of
Wow.
mebendazole,
So
right?
you
It's
would, it'd
it's
be a fortune.
you would be paying a fortune. And guess what? There are a number of clinical trials using mebendazole for cancer in humans. They're looking at it for brain cancer, they're looking at it, lung cancer, a couple of other rare cancers. And so those trials are ongoing right now in big cancer centers
Hmm.
because now there's money in it. So the pharmaceutical companies, say, okay, let's look at mebendazole and let's get it out on the market and make some money.
So if it becomes like you know a couple of $1,000s a week, then now they're interested.
Exactly. And it all comes down to money. Cancer is a huge business. It always comes down to money.
Yeah.
Now the good news is that, let's say, you're concerned about, you don't want to use a veterinary product that's not FDA approved, and you want to use mebendazole, which is FDA approved for cancer. You can get generic versions of mebendazole. You can get it, from India, you could get it from Mexico. You can get the
Mm-hmm.
generic version for a few dollars a pill. So you can get your hands on it, and people have done it. So, you could use fenbendazole or mebendazole. But the point is you have to take uh, your health into your own hands. I have hundreds of people emailing me all the time asking, can you recommend a doctor who's going to prescribe me fenbendazole? Or can you, recommend a doctor who's going to prescribe me, let's say, high dose ivermectin, for example? That's another antiparasitic that has powerful anti-cancer properties. And I think to myself, why are you putting your hands in a cancer doctor whose hands are tied? They cannot prescribe you,
Mm-hmm.
these antiparasitics, because, the medical associations will go after their medical licenses. They're going to lose their jobs. And so doctors will not put their careers on the line to save your life, because they're looking out for their jobs and their careers first. And the way oncologists do that is to go and play along with big pharma.
Yeah. Well, I know several doctors that have told me that they basically believe in, they're natural oriented doctors, and they've been through it kind of like you have, and they're like figured out a way to work with people, and kind of certain different laws, and some are even naturopaths,
Yeah.
but that believe in the fenbendazole, to use that no matter what, even if somebody's doing chemotherapy, that they believe in the using that, because you have nothing to lose with it. And like you said, it really has a lot of good research behind it. I've read some of the research about it, and it also acts kind of like an activator for the P53 gene, which is the tumor suppressive gene that I think what I think is people that have cancer, and I don't know, I'm just sort of, bouncing the ball off the wall, but I got a feeling that most people that have cancer have a underactive P53 gene, maybe mutated, maybe they've inherited it. I don't know, because why do people get cancer and others don't? And some have a terrible lifestyle, and some people try everything. They eat healthy, they exercise, they do the right things compared to most people, and they still have a hard time. And I don't think a lot of people are looking at that, and looking at things that really can activate that. And the fenbendazole sort of acts like a kind of a real booster for that, I think, is what I've heard. And also, tell me if I'm wrong, there's some research that shows that it acts almost like a uh, sugar blocker to the cancer cells.
I see you've done your research.
Well, I've interviewed these guys and I've talked
Yeah.
to people, and but I find it so interesting that we could all probably benefit from a stronger P53 gene, and some of the other cancer fighting genes too. But my gosh, and the other thing is, people will say it has nothing to do with that, but I've been in the health industry for many years and studied with some of people I think were masters at what they did. And I was always told that, like parasites, for example, intestinal parasites, even though they say it has nothing to do with it, some people, but I still think that intestinal parasites is one of the most immunosuppressive organisms you could have in your body. And if you've got cancer, your immune system is usually suppressed, usually you don't have, things aren't working at the way they should. There's a level of toxicity or something going on in the body. There's a level of all kinds of things. But, it only makes sense to me is that th this fenbendazole could help kill several birds with one stone.
Absolutely. And that's what's so fascinating about fenbendazole. It's got so many mechanisms of action, but you bring up, I think, two maybe of the most important ones. One is the sugar utilization by cancer cells, which fenbendazole inhibits. It blocks the uptake of sugar into cancer cells, and it
Hmm.
also blocks the ability of the cancer cells to use that sugar to grow. And so that is one of the unique features that I found when I was doing my research on fenbendazole, and this is peer-reviewed research, that it's proven. It is proven
Yes.
that it blocks the uptake of sugar into cancer cells and then the ability of cancer cells to use it. And there's not a lot of things in the world that can actually do that. So that is a very key feature and a unique feature of fenbendazole and mebendazole that I think is fantastic. The other one you mentioned is p53, and p53 is a tumor suppressor gene, a tumor suppressor protein, which stimulates apoptosis of cancer cells. It stimulates basically the destruction of the cancer cell death. And you're absolutely right. P53 is implicated in many cancers. I would say probably most cancers. P53 levels have been found to be low, or P53 has been found to be mutated for whatever reason.
Mm-hmm.
And I'll tell you another thing I think P53 is going to be a big deal, especially in this era of COVID-19, because it has been found that the spike protein from SARS-CoV-2 also interacts negatively with P53. And that may be one of the reasons we're seeing an explosion of cancers, especially in people who've had, the COVID-19
Yeah.
vaccines. So
Yeah.
P53 is a big deal.
Turbo
And
cancer, is that what they call it?
what's that?
Turbo cancer?
Absolutely. So yes, right now it's being called turbo cancer. I know a lot of people don't like the term. Certainly mainstream doctors absolutely hate the term.
Oh
They think,
yeah, yeah.
the phenomenon doesn't exist, but it's very real. And thousands of people are suffering from cancers after taking, either Pfizer or Moderna COVID-19 vaccines. So P53, I think, is going to be extremely important. And fenbendazole, again, has been proven to stimulate the production of P53. So it dramatically increases the levels of P53 in your system. And now that, allows other processes that are dependent on P53 to, kill the cancer cells. So that was one of the things that I found very fascinating about
Yes.
fenbendazole.
Do you find that from your experience and from your research that the fenbendazole is one of the more powerful stimulators of the P53?
Absolutely. Yeah, absolutely. I think there's no question about that. And so, you've got this very powerful anti-cancer agent, fenbendazole. Now, it's not FDA approved. It's used for veterinary uses. So, you could give it to your dog, or you could give it, to some small animals. But, FDA will not give it approval because Big Pharma will not do the human
Yeah,
clinical
yeah,
trials, right? And
yeah,
so, but again, if you take matters into your own hands, and I think that's why Joe Tippen's story is so important,
yes.
because he just, they sent him home to die. He had stage 4 small cell lung cancer, which has a very, very poor prognosis.
Mm-hmm.
Um, I believe, less than 1% of people survive over the following 5 years after diagnosis.
Yeah,
So it literally is a death sentence. They sent him home to die. They didn't say, hey, look into fenbendazole, ivermectin, look into high dose vitamin C, look into some medicinal mushrooms or some supplements, look into apricot seeds, soursop, garlic, ginger, quercetin. No, the oncologist sent him home to die with absolutely no recommendations.
yeah.
Right? So then he goes on, does his own investigation. I believe he had a friend who was a veterinarian or a veterinary
Yeah,
researcher
yes.
who knew about the anti-cancer effects of fenbendazole in small animals. And so he said, you know what, I'm going to try it. And that is so important, what he did.
Well, you know the full story, right? With the doctor that was doing the research that worked for the Merck, the drug company.
Well, maybe you can just sort of refresh me.
And I might not be 100% on this, but what I've understood, and that there was a veterinarian friend of his from college that told him about this study and about the fenbendazole might be worth him trying. And there was a doctor doing study with mice with cancer, and she discovered that the mice, well, she injected cancer cells into the mice and everything.
Mm-hmm.
So then she discovered they had parasites. So she says, "Oh my gosh, you know, I better give them some fenbendazole." Fed them
Right.
a bunch of fenbendazole. Comes back in and discovers that the cancer's gone in most of the mice, and then the parasites are gone, but also the cancer. So
Yeah.
she's like, "Oh my gosh!" Well, she developed cancer herself, some kind of I think it was a glioblastoma, I
Okay.
believe. I might be wrong. I think that's what it was. Is that what it was, Matt? Brainstem cancer.
Oh, okay. Yeah, yeah.
And so she ended up developing this cancer and thought, well, I'll just do the fenbendazole and see what happens. And I don't remember if it was 3 or 4 months later, I evidently took care of the cancer. Now, you know, I didn't talk to the doctor. I'd like to have interviewed the doctor, but we couldn't, that wasn't going to happen because I believe she still works for the drug company. But anyway, it's an interesting story, and it got my attention. And when I first heard about Joe Tippins, but you know, I think Stanford University's done some studies with it, you know, and looked at it, you know, just to kind of see, you know, how much someone could actually take of this canine product. You know, I mean, as you say, it's not FDA approved, and you know, I guess it's something most people think of as given to their dog or cat or something like that. But you know, I just, you know, they did these studies that showed some of these things like what you're talking about, and it's an interesting thing. And
You know,
uh,
I'm a big believer in this concept of right to try, you know,
yeah,
and it's a when you're faced with stage 4 cancer and you're faced with death, you should have the right to try. And actually, doctors should have the right to try
hmm,
alternative treatments that, you know, have some evidence, but maybe they haven't had the chance to have the full clinical trials in humans and so on, but they've been shown to be safe and there's some evidence of efficacy, like there is for actually, there's tremendous evidence of efficacy for fenbendazole. We call it sort of preclinical trials. And so this is when they look at mice or they look at, you know, how the cancer cells react and so on. So there's tremendous preclinical evidence that fenbendazole is highly effective against cancer. You've got the safety studies that show, you know, you can take, you know, certain amounts of doses and have virtually no side effects. And so, you know, doctors should be allowed to try
hmm,
these alternative treatments in cancer patients who, you know, are in a desperate situation. And so I think it's called right to try legislation. I think some of the states in the United States have it. We don't have such a thing here in Canada. I wish we did.
hmm,
But you know what Joe Tippins did was brilliant and
yeah,
so important because he basically paved the way. You know, he found a dose. He found a dose that worked for him. It cured his stage 4 cancer, which had a horrendous prognosis. It saved his life.
yes,
And he paved the way for many others to try a similar type of protocol with
yeah.
fenbendazole.
Well, as I told you earlier, I've interviewed several people, you know, here at Templeton Wellness that have actually used the fenbendazole. You know, I haven't followed up with them in the last you know, few months or anything, but you know, they had cancer, full blown cancer. One lady was a nurse, had was retired, had a huge tumor in her colon, and she took the fenbendazole, uh, and she, you know, 3 or 4 months later, no signs of any cancer. You know, then there was another gentleman that had cancer, several types of cancer in his body, and he was just riddled, and same thing with him. And, I asked him, did you change your diet? And he goes, oh, Lord, no. He says, I'm eat terrible. I mean, I'm a guy that says eat healthy, do it all, because
Yeah.
don't do one thing, say, oh, this will work. If it doesn't work, I guess that's the end. I mean, you got to look at your life, what you've been doing, and make some changes, I believe, and sometimes it's self-induced, sometimes it's we're just exposed to things or we're under a lot of stress. Combination, as you know, of the perfect storm
Yeah.
that's just going to happen no matter what happens. But I found it so interesting. I asked Joe one time. I said, Joe, do you know a lot? I want to interview other people. We don't just do fenbendazole here, but it's like an interesting thing that if it's not going to be too toxic to somebody,
Yeah.
and if a person wants to do it, at their own risk, I guess you could say, and why not? You know, try it. But I mean, what else do you have to lose? I mean, I know that you've talked a little bit about the toxicity levels, some of the studies that have been done with, the amounts for different types of level of cancer, maybe, or how advanced something is. Maybe they have to take more or less. Because I've also known people that took the fenbendazole, claim that didn't help them. Now, again, maybe they weren't taking enough. Maybe they didn't take it enough days. Maybe they didn't. Maybe for Joe and these other people, maybe it was just the perfect amount for them,
Right.
so like you said, so it's an interesting thing. Now, can you tell us a little bit what you know about the the levels of, maybe if someone's interested in maybe trying fenbendazole, I don't know if you can do that or not, but how much is safe for people to take, without liver toxicity, for example?
Right. So, I believe the dose that Joe Tippins used was 444 milligrams. Uh,
222 milligrams. It was
222. Okay.
222, 3 days a week, 4 days off.
Okay.
And of course, he was doing, some CBD
That's right. Yeah.
oil and also some curcumin. And I think he was doing 500 milligrams a day of curcumin and,
Right.
and maybe some vitamin E and stuff like that. But which, curcumin can activate the P53 also.
That's right.
And I don't know how much is recommended. I mean, some people say 1,500 milligrams a day of curcumin. It depends on the type and how well it's absorbed. And,
That's right.
and,
Yeah.
I take a lot of supplements. So I've tried some I don't, that do not seem to absorb as good as others, as far as what people say. I don't know,
Right.
but
So,
it's
so if
all
you could,
interesting.
yeah. So if Joe Tippins took 222 milligrams, like you said, 3 days on, 4 days off a week. I've seen people use 222 milligrams, let's say 6 days a week. I've seen people use 444 milligrams 6 days a week. Some have even pushed it to 888 milligrams. I think it's at that point, you probably want to at least look at the liver function tests,
Hmm.
have that blood work done just to make sure that you don't have any sort of liver toxicity. Now,
Like
in
high
terms of the
enzymes in the liver and
that's right. Yeah, you just look at the liver enzyme. It's very simple blood work. A lot of cancer patients already get, that type of blood work anyways. So you ask your family doctor or your oncologist to do those liver function tests, they're called, just to make sure that, your liver's not suffering. So I've seen, yeah, pushed up to 888 milligrams a day, let's say 6 days a week. And I think you have to take fenbendazole, you have to take with food. And now the maximum dose, the studies that they've looked at in mammals, I think you could push it up to 50 milligrams per kilogram, which is in a 60 kilogram person, that would be 3 grams a day, right? But again, you start getting into potential liver toxicity or at least your liver function enzymes starting to go up at that point. So, you probably want to stay in that region. 444, 222, 444, I think seems to be
yeah.
a good spot for most people. And again, it's something that, your oncologist is not going to tell you or recommend. I don't know if there's doctors, functional medicine doctors in the United States who are, giving their patients fenbendazole without the regulatory agencies or medical boards, coming after them. It certainly would not be possible in Canada. They're extremely strict here. But again, it's very easy to get the fenbendazole, and it's so crucial to take matters into your own hands. One thing I also want to mention is that, the way I look at an alternative cancer treatment plan, and you've mentioned this earlier that, you have to look at your lifestyle and your eating and so on. And I break it down just into a couple of main categories. And so one category is diet, and I look at fasting, and fasting especially. So if people do intermittent fasting, which is,
Mm-hmm.
16 hours, 18 hours, 24 hours, but I like to look at a bit longer fasting, a 3-day fast or a 5-day or a 7-day fast. And what those do is they kick in a process called autophagy, where the body itself starts destroying cancer cells or precancerous cells and starts clearing them from the system. So I think fasting is a key component of any cancer plan. And I think a ketogenic diet, or as close as you can get to a ketogenic diet, is also, I think, important because cancer uses sugar as
Yes.
fuel. And so if
Mm-hmm.
you starve the cancer of that fuel, I think you're giving yourself a much, much better chance. And so that, that's one category. Then there's another category that I like to call the repurposed drugs. So drugs that are used for something else but have powerful anti-cancer properties. And there's not a lot of repurposed drugs that can actually cure stage 4 cancer, but fenbendazole is one of them. So fenbendazole or mebendazole is, you could call it a repurposed drug because it's used as an antiparasitic, but it has the ability to cure stage 4 cancers. Another drug like that is ivermectin.
Mm-hmm.
Ivermectin in high doses can cure stage 4 cancers. And again, interestingly, it happens to be an antiparasitic. CBD oil, cannabidiol, it also can cure brain cancers specifically, right? So people are using CBD oil for brain cancers. Now, interestingly, I believe CBD was part of Joe Tippens's protocol as well.
Yes.
So that was a good addition to have. People get vitamin C IV infusions. That in some cases has been able to cure late stage cancers as well. So there are a few of these things that I think everyone should have in their toolbox, and have it in mind that when your oncologist tells you, sorry, there's nothing more we can do for you. Well, no, actually there are
Think,
things you can
think
do.
again, think again, right?
Exactly.
I mean, I believe that once you start to believe that there is something else you can do and you start to do something, you start to feel the changes, you start to believe in what you're doing. I believe that's a big plus. I talked about emotional stuff, believing, I think can be up 50% or more because, when you're in fear, a state of fear and anxiety, how good is that for your overall health and immunity?
You're right about that as well. I mean, the mind is very powerful. If you're negative or if you're anxious or depressed, you're going to have
Hmm.
worse outcomes
Yeah.
than someone who has a very positive mindset, who has faith in God, and who approaches things, in a positive way and with faith. So that is a powerful component as well. And then there's the categories that I call bioactive compounds. And bioactive compounds, you can get them from food, certain foods that have, hundreds of anti-cancerous bioactive compounds. And I'm talking about things like garlic, ginger, certain exotic fruits like soursop, apricot seeds is a big one. And the medical authorities have come after apricot seeds very aggressively. But there are compounds in apricots and apricot seeds that have anti-cancer properties, very powerful anti-cancer properties. So
Amygdalin, right?
yes. And so you want to have that in your toolbox as well. You say, okay, well, there's certain foods I can take that have anti-cancer properties.
Hmm.
Now, some of those foods, you can't eat enough of them to get certain compounds. So that's where something like curcumin comes in, right? And you want to get a bioavailable version of curcumin for example. There's resveratrol, which is found in grapes and wine. You've got quercetin, olive leaf extract. So olive leaf oleuropein, which is an anti-cancer agent. That's a big part of the Mediterranean diet. So, people in Italy and Greece and Turkey, they use a lot of olive oil. It's got, oleuropein that is a powerful anti-cancer agent.
Mm-hmm.
So they've got that as part of their diet already, right? But some people will want to supplement with that, for example. And so, you've got these things that have bioactive compounds. And another category, which I'm starting to dive into, is medicinal mushrooms. Uh, Things like turkey tail mushrooms or chaga mushroom, reishi mushroom, lion's mane, cordyceps. These are mushrooms that have powerful anti-cancer agents as well. You want to have, some of that in your toolbox as well. So, this is sort of my approach to what I would call an alternative cancer treatment plan. And whether you're taking chemo and the radiation, or whether you decide not, to skip those, you can use those alternative treatment approaches in any case of cancer.
Do you like, if someone's doing chemo, do you like something that's more like a insulin potentiation therapy that basically is a smaller dose of chemotherapy for people? Some people need it, I think, based on what I've understood from some people, because maybe they've got, I don't know, maybe a large tumor or something, that they can't remove, or, whatever, and it helps to, this full dose chemotherapy can really be hard on your immune system. And that, the smaller dose, like the targeted chemotherapy, sometimes people seem to have good results with that. Again, you're not going to find a lot of doctors that are using that, as far as what I hear, unless they're kind of more naturally oriented, or under the radar somehow in most places.
Right. And I think, speaking now as an oncologist, who was part of the system, I think even as oncologists, we all want to move away from chemo, as much as possible, because, chemo is just such it's such a blunt tool that does so much damage to
Mm-hmm.
your healthy tissues, to your bone marrow, to your blood cells. It's all the cutting edge research, and even the research that I was doing with targeted radiation therapy, we had almost no side effects. I had a cancer treatment where you could give an injection, just observe someone for maybe an hour, make sure they had no, unexpected reaction, and you send them home, and they had no side effects, no even nausea,
Mm-hmm.
vomiting, nothing. You wouldn't have to
And
even put them on
didn't
nausea.
lose their hair or anything.
Nothing. Because what would happen is you'd have the radiation linked to a little protein that would deliver the radiation directly to a receptor on the tumor cell, drop the radiation kills the cell, you pee the rest of it out, so it's gone within your system, in less than 24 hours,
Mm-hmm.
and you have no side effects, right? And we saw stage 4 cancers completely disappear. Now, of course, once my program was sabotaged, Justin Trudeau now has a monopoly in Canada on it. The FDA sat on it for 20 years. They would not approve it until the big players positioned themselves, acquired all the small companies, and now it's going to be a multi-billion-dollar industry, and they're going to make big money off it. But that's how it is in cancer, right? And we had, a cure for cancer of that particular type. We had it for a long time. It was developed in Europe back in 2000, and the
Mm-hmm.
FDA sat on it for 20 years because until the big players could figure out how to profit off it. So, I mean, chemo is, we're all trying to move away from it as much as we
Yeah.
can. But when you're a mainstream oncologist, you have to follow the big pharma playbook, unfortunately.
The scary thing to me is that, uh, I mean, almost 1 out of 2 people are going to get cancer in their lifetime, and of some sorts. And it's getting close to that. And it's kind of like most people that get cancer, find out from a regular conventional doctor, oh, you've got cancer. Oh my God, and so you need to do surgery, chemotherapy, radiation, the whole thing.
Yeah.
And so people are like, okay, well, let me think about it, or either they just do it. But people that want to do more natural oriented treatments, like some of the things we've talked about, or maybe they're late stage and the doctor says, well, we'll give it our best shot, but this doesn't look good, and your prognosis doesn't look, like it's, I mean, I don't know, it's kind of not if, it's when, you know. So, I mean, those kind of people really need to start thinking outside the box. I mean, it only makes sense, but unfortunately, a lot of those people don't have the money to go out
Yeah.
and do this. And insurance, they got insurance over here in this country. It's insurance. Okay, well, insurance only cover this, and anything that's outside of the box, not going to cover it, and that could
Yeah.
be, four or $500,000 or whatever. Natural
But
treatments usually aren't that much, but
no, and the thing is, I want to mention something about this because that's a very fascinating point you bring up. When
mhm,
I was when I was sort of in my cancer clinic, and people would tell me, they would say, "Look, I don't want your treatment because I'm skeptical." And I said, "That's perfectly fine, no problem. I'll be here. If you decide to come back, we'll redo the imaging and we'll see where we're at and so on."
yeah,
I never pushed any treatment on anybody. I think it's unethical to push any
sure, sure,
treatment on anybody. And people would go off and they would maybe go to a clinic in Mexico, or they would go to a clinic in Brazil. But you know what they do at those clinics is they do exactly what we've been just talking about. They look at some of these repurposed drugs. They might use ivermectin or fenbendazole. They might use CBD oil. They might use vitamin C infusions on a regular basis. They'll change your diet. They'll supplement your diet with all these other things that we've talked about. And so, but they offer it in a structured way, and you have to pay for it. Like, you have to
yes.
pay at least tens of thousands of dollars to visit some of these clinics.
Every time you go, it's, 15 or 20,000, stick your head in the door.
Exactly. And sometimes it works, sometimes it doesn't. Some clinics are better than others, of course, right? But the point is that if you take control of your own health,
Hmm.
you can actually prepare a treatment plan, an alternative treatment plan, and there is a lot of knowledge now available,
Yes.
online, and so you can prepare a treatment plan for yourself. You can, and like we talked about, ivermectin, fenbendazole, these things are dollars a pill. You find a way to get your hands on these things, whether you use, a human version or a veterinary version. Um, you get your hands on these things, you get the supplements. The supplements are not that expensive, and you can have an incredibly structured alternative cancer treatment plan that's not expensive at all, that won't, break you or bankrupt you financially. You just have to put in the work and
Hmm.
the effort. And a lot of people are not willing to put in that work, but that's the difference, is that if you take matters into your own hands. And that's why, Joe Tippins' story is so inspirational,
Yeah.
because he said, okay, well, you're sending me home to die. No, I'm going to, find a alternative treatment protocol for myself. And look, he cured his stage 4 cancer, and he saved his own life.
Yeah. Well,
And more people need to do that.
you're right. And people can do this on their own, and maybe work with somebody a little bit, or have a a functional medicine doctor or integrative
That's right.
doctor that you
Yeah.
can go and get blood tests and you
And
know
imaging, exactly.
yeah,
Yeah.
and all that. And you need that. Everybody needs that. I mean, I've got a functional medicine doctor that I see. I've got a couple of them, and they don't think I'm nuts because I take 100+ pills a day of vitamins and supplements, and eat a organic diet and all that. And don't think it's, expensive pee, so all my vitamin C. But need people like that. But there's naturopathic doctors that can do a lot of this too, and you can get
Right.
IVs. A lot of people where you can go get an IVs and a vitamin C
That's right.
drips.
Yeah.
I'm a big proponent of vitamin C because I feel like it's kept me around for all these years, and but yeah, people can do it, they just gotta, like you say, you gotta roll up the sleeves, and some people won't do it, that part.
Right.
the easy part is laying it out and saying, okay, well, that's a lot of stuff, but okay, it makes sense. But the hardest part is actually doing it day to day to day.
Right.
Can't be cutting a lot of corners when it comes to, you're not gonna get you get what you put into it, I guess is what I'm saying.
Absolutely. And I
And
and I think, these days more than ever, I think it's important to take matters into your own hands because, we're being our health is facing attacks on many fronts. We've got food that's not very good, not high quality. That's compromised. Our water's being compromised, our air is being compromised, and then on top of that, you've got this push with these viruses, these gain of function viruses that they've been tinkering and playing with, whether it was coronaviruses or now it's influenza, now the big scare. They're pushing influenza H5N1, avian flu, right? I think they started it in Texas with the dairy farms, and now they're trying to, drum up this fear. And of course, what's the point of it? Well, they're going to be pushing new influenza mRNA injections on us and telling us that that's going to save people's lives, right? And so right now, the pharmaceutical industry is absolutely obsessed with vaccines, with, especially with these mRNA vaccines. They're building factories all around the world. They want to be pumping everyone with jabs. And it's like the answer to everything is a jab right now, right? And that's just not the way. It's an attack. These jabs have been shown to actually damage your immune system. They don't stimulate your immune system or make your immune system function better. They end up damaging your immune system. And the more of these shots you take, the more damage you take. And some people, who trust the medical establishment and have rolled up their sleeves, 4, 5, 6 times. Here in Canada, up to 9 times. We've had our corrupt public health officials recommend up to 9 jabs. And these people are now very sick.
Mhm.
They're coming down with all kinds of illnesses, whether it's cardiac illnesses, autoimmune diseases are now skyrocketing, neurological diseases, this early Alzheimer's, multiple sclerosis, Guillain-Barré, transverse myelitis, all these, these exotic neurological diseases now are skyrocketing. And of course, the cancers, the turbo cancers as well is a big one right now. So
Yeah.
the way I look at it is that we're under attack from multiple fronts. And, no one is out there looking out for our health. When
Yeah.
when the pandemic hit, what were they doing? They were saying stay indoors. They locked the gyms. You can't go to the gym. So no fresh air, no sunlight, no vitamin D, no exercise. Right? So it was everything they recommended made people
Yeah.
sicker,
And
right?
everybody's living on their cell phone, and all the EMFs and the ionizing, non-ionizing radiation is just bombarding us everywhere. I mean, it's just, I mean, with no wonder there's so much cancer. It's just
Yeah.
gone through the roof, and people are under a lot of more stress.
Yeah.
Inflation is higher. Everything's corrupt. It's terrible.
Yeah. And I think really the future, what we saw is trust in doctors completely evaporating. And with
Hmm.
good reason, because most doctors completely abandoned their Hippocratic oath to do no harm.
Yeah.
And most doctors did harm, did cause harm during the pandemic. So trust in conventional medicine has been completely lost. And I think it's going to be
Hmm.
gone for generations. Once that once that trust is lost, you're not going to regain it. All the medical associations are completely corrupt. The journals are corrupt. And so I think we're going to see a massive movement towards natural medicine or some of these more natural ways of approaching your health. I think that's why fasting is going to be a big part of it because nobody makes money on fasting,
No.
right? In fact, even the food industry doesn't make money when people are fasting, right? And so uh that's going to be a big component of it. And a lot of these, these natural products that have either antiviral or antimicrobial properties or anti-cancer properties, I think are going to be
Yeah.
big in the future.
And just like with anything, you got to do your research, and that's kind of what we do here at Templeton Wellness is try to educate people so they can do their research in a few days they can get educated by listening to interviews like today and other interviews and make a very hopefully a good decision, maybe a smarter decision. Maybe they'll understand why they got cancer in the first place. And it's not just inherited because their mother or grandmother had it. And you know what I'm saying? It's like they'll figure out how much is really self-induced, instead of like, whether they're responsible or not. They're living in the world that we all live in, and we're all drinking the water and eating the food, and we're exposed to everything, in the that everybody's exposed to, and God knows what else they're planning on doing to us, and from one year to the next, and but yeah, it just makes sense for people to do that, and I mean that's what we're all about, and I know that's what you're trying to do, and it's just it's not a fun thing, but most of us have gotten way out of control with our lifestyles. So it's just no wonder. I mean, no wonder there's so much sickness. But people it doesn't seem to bother certain people out there, that are raking it in. And I was going to say that even though people say they're a natural doctor or they're this or they're that, you still can't necessarily trust them either. There's people out there just trying to make as much money as they can. They don't really care. I've been in the natural health business for years, and you know, has nothing to do with this, but and I've seen that over the years. I mean, there's just as bad as the other side too. So you got to do your research. You got to listen to your intuition, and maybe pray to God or whatever you need to do, or to the higher power, and to make some better decisions, and once you kind of know within yourself. I think you feel like you're on the right track. You learn to trust people that you work with, and I mean that's really all you can do, really.
Yeah. And I do that on my Substack now. I have a Substack, makismd.substack.com. It's fast becoming one of the most popular Substacks, health Substacks in the world. I have about 180,000 followers on Twitter, 40,000 followers on Substack, and I reach about 20 million people worldwide. And
Wonderful.
the health authorities have tried to actually shut down all my social media. They've gone to court. They've spent millions of dollars in legal fees trying to get me shut down, silenced. And I've kind of persevered and
You,
pushed through that.
you've gotten too big. You've got
Yes,
too
I
much.
think well,
That's what you
maybe
got
now
too
I've gotten a
much.
bit big.
Yeah, so once you get to a certain level, they quieten you down, it's just.
Exactly. And so, but I'm getting that information out there. And again, like I was a mainstream oncologist, and I saw all kinds of corruption, and I did the best that I could, with the tools I had and so on, but I could have done more. I could have, done a lot of the research into alternative approaches earlier. But I'm doing it now. I'm sharing it with people, and I still go to the scientific literature. So when I wrote my articles about fenbendazole, for example, and Joe Rogan actually read my article on one of
Mm-hmm.
his shows. He was reading, my article
Yeah.
about different mechanisms of fenbendazole and so on. But when I do that, when I write these articles, I still go back to the literature. And the reason I do that is because there are researchers in other parts of the world, whether it's Mexico, whether it's India, Indonesia, South Africa, who are doing the research into these alternative approaches, um, or foods with bioactive compounds. And they're doing the research, they're doing it properly, they're getting it published. And maybe it's not going to be in a prestigious American journal, but it's going to be
Mm-hmm.
published somewhere for someone to look at and read and say, oh, wow, these guys did the testing on their patients, or they did it in mice or what have you. So, I still rely on research that's done around the world. And what I've noticed is in North America, you don't get a lot of that kind of research. You really have to go outside of
Yeah.
North. because in North America, the pharmaceutical industry has really a stranglehold on cancer because they want to make money, right?
Yeah,
But when you go to other parts of the world, they're using all kinds of interesting alternative approaches and approaches that work. So
yeah.
it's fascinating to see.
Well, I appreciate everything you're doing, and congratulations on your success with getting the word out. And I know they've been hard on you, but you're hanging in there, and you're getting still, uh educating people, and that's important. And is there anything else that you would like to say that we haven't talked about real quick?
I think we've covered a lot.
Hmm.
But I think people shouldn't be afraid. I think if there's a sort of an overall message, and we've talked about this already, is taking matters into your own hands. Don't be afraid. Just take your health into your own hands and don't rely on doctors, for example, who may just be protecting their jobs or their careers, and they may not tell you of the alternative treatment approaches that are out there.
Hmm.
And if you just sort of, write it out, let's say you write out the categories, okay, I'm going to look into a diet with no sugar or a ketogenic diet. I'm going to look into fasting. I'm going to look into some of these repurposed drugs like ivermectin, fenbendazole, CBD. I'm going to look at things that stimulate the immune system, vitamin D, for example, vitamin C, a powerful antioxidant. Then they could say, well, I'm going to look into some of the foods that I've heard have anti-cancer fighting properties, olive oil, uh, garlic, ginger, apricot seeds,
Hmm.
right? They could say, I'm going to look into some of the mushrooms. Maybe you want to take a look at turkey tail mushroom, right? Or lion's mane or something like that. Let's say to help stimulate and improve your immune system. And look into some of the supplements that are readily available. Things like curcumin or quercetin, resveratrol. Uh, and right there you have a plan that you can then go and then you look at kind of the individual components
Hmm.
of that plan. It actually doesn't even take that long to put together. But if you take matters into your own hands, you will always do much better than if you just rely on the medical establishment.
Well, it sure makes a lot of sense to me, and I really appreciate you, Dr. Makis, and thanks again for coming on today. And I look forward to hearing from you again someday about all the new things you'll be coming up with, and as we can help as many people as we can here. So, everyone, thank you for watching today. Uh, Check out our other interviews. Check out Templeton List. I think you'll find that a great tool for eating healthier. When you're out and about. I think it's important to eat as healthy as you can, and that probably means eating at home most of the time. But anyway, when you need to get out, check that out. And I've enjoyed this interview very much today. And this is James Templeton. We'll see you next time.